What else do you think? Pyloric stenosis. So we're talking about narrowing of the pyloric sphincter, right? Okay. So your first sign for a baby with pyloric stenosis would be mild vomiting, and then it's going to progress to projectile vomiting. Okay. Mild vomiting that progresses to projectile vomiting. Later, you're going to be able to palpate a mass.
You asking me?
No, I'm telling you. Yeah.
Oh, okay.
Yeah, the later sign, you'll be able to palpate a mass.
Okay.
Palpable mass. Kawasaki disease. We talked about that quite a few times. We know that it can cause a heart problem, right? What type of heart problem? What heart problem can Kawasaki cause? I mentioned it. What is Kawasaki?
Was it congestive heart failure?
It's not congestive heart failure. But what is Kawasaki? Inflammation, right?
Mm-hmm.
So it's inflammation of everything. Okay, so when you think about Kawasaki in relation to the heart, think about inflamed heart vessels. If you have coronary artery inflammation, you can have an aneurysm. So coronary artery aneurysm. Okay, does that make sense?
Yeah.
Okay. We also talked about bronchopulmonary dysplasia. Dysplasia is an abnormality or alteration, right? So bronchopulmonary, we know that's in reference to what? Respiratory. When can you get bronchopulmonary dysplasia? When is it most likely seen in the patient?
When it's most likely seen?
Right. When is it most likely seen in the patient? Mechanical vents.
You mean like if they had a flu or something?
Nope. Mechanical vents. Because bronchopulmonary dysplasia is scarring of the lungs, right?
Mm-hmm.
So mechanical ventilation is when you're most likely going to see it. What type of patients are normally on mechanical vents in relation to newborns? What type of neonate would you see on a mechanical vent? A preemie, right?
Mm-hmm. Right.
If they're born prematurely, more than likely they're going to be mechanically ventilated. So they're going to be put at risk for this. Children who drink excessive milk. I'm talking like more than 3 to 4 cups of milk a day. Too much milk reduces intake of other essential nutrients, especially this one. Like what?
So if they drink too much milk, can't they get a teeth decay?
Well, no. Vitamin D is pretty good for the teeth, so that wouldn't be it.
But are they lacking like potassium or something?
Iron, yep. Too much milk would reduce the intake of the essential nutrient iron. So if that's the case, what are we going to be looking for in relation to this patient, this child? What disease process? If I'm lacking iron, what am I at risk for?
So iron deficiency, you're at risk for like their bones not gonna be strong, right?
Well, not necessarily bone related. Think about. Say it again.
That wasn't me.
I'm sorry, that was me.
Oh, hey, Fallon.
Hey, how are you?
Good. So, we were just talking about iron deficiency in regards to children that drink excessive milk. And we want to know what condition will we look for.
Excessive milk.
Yep. What about anemia? Right? If you lack iron, you're at risk for anemia. So that's what we want to look for.
Did we say the condition?
Anemia.
Oh, okay.
But is it a certain type of anemia or just
iron deficiency anemia?
Oh, iron deficiency. Okay.
Mm-hmm. Since we're talking about it, give me some other types of anemia.
Pernicious anemia.
Characterized by what?
What you mean? Like, what's the symptoms of?
Well, yep. What is this character?
Is that the one where people I might be wrong, but I'm just gonna take a guess.
That's okay.
Where people be eating like starch and stuff.
You're thinking of pica. So pica is where you because you're lacking a nutrient, you're gonna eat things that are not edible, like cornstarch, stuff like that. Laundry detergent typically is what a lot of people sponges. I've seen people eat sponges. So, yeah, not good for toxicology. So when you're talking about pernicious anemia, though, what did we say the cardinal sign was for pernicious anemia? What are they lacking? They're lacking something, right? Mm-hmm. They're lacking the intrinsic factor.
Oh, okay.
Right? Remember that? Remember we talked about that a little bit? That they're lacking that intrinsic factor. And so they have to get something, a vitamin.
Don't they need they need iron, they need that red blood cell, right?
No, they need B12. Yep. So pernicious anemia, they need B12 every day. Every month for the rest of their life. Mm-hmm. And B12 is given which route?
It can be given injection or you can take the pills.
You can take the pills and you can take an injection specifically for pernicious anemia. Would it be
injection?
It would be injection, right. They can't take it PO because they lack that intrinsic factor, so they're not able to absorb it. That's right. We talked about Synthroid. We said that we give it in the morning. Why?
They need it early because it's for their thyroid, right?
It is for the thyroid. Yep, Synthroid is for the thyroid. But we're going to give it early because it causes what? Fallon, you know?
I don't.
Okay. It causes insomnia. Makes sense though. Think about it. If you have hypothyroidism, you have low thyroid. I'm going to give you synthetic thyroid, which is Synthroid, right? SYN, synthetic thyroid. And I'm expecting that this medication is going to do what you don't normally do. So I'm going to expect an increase in metabolism. I'm going to expect high heart rate, things like that. The opposite of what's going on with you on the pathological standpoint. So I'm going to expect those symptoms to reverse. So that's why. So instead of you actually being fatigued and lethargic, I'm going to expect you to be an insomniac if I give you symptoms. Why is insulin needed for a patient that is taking prednisone?
Because prednisone raises the blood sugar.
That is true. Prednisone raises blood sugar. We talked about a rare blood disorder that is seen in patients where the mother passes the disease to the son. There's two types of this disorder, and tell me what they are, and tell me how do I know which type it is, and how do we treat it. So you gotta tell me a lot.
Sorry.
Okay, so this rare blood disorder we talked about is two types of it. The mother passes it to the son. It's an excellent recessive trait. I want you to tell me what they are. I want you to tell me how do I know, how can I identify between which one is which, and how do I treat it?
I think I missed this lecture.
Okay, that's all right. Let's think about it. So I'll give you one. Classical hemophilia.
Oh, hemophilia A and gosh, what in my book? Because I wrote it down.
Hemophilia A and hemophilia B, right?
Yeah.
Yep. So hemophilia A is classical hemophilia, right? Hemophilia B is Christmas disease.
Mm-hmm.
Hemophilia A is factor what? Happy you know this one.
I do.
Yes, you do.
Okay. So it's factor 9. Oh, no. It's factor 8, right?
It's factor 8. It's factor 8. Yep.
My notebook.
Yep.
That's in my bag where my earphones was.
Classical hemophilia is factor 8. Hemophilia B, Christmas disease, is factor 9. How are we treating this?
You give them the factor that's missing.
There you go. You give them the factor that's missing.
Right. Treatment replace the factor, right?
Yep.
Yeah.
It's determined, and the test is called the factor assays, and that's essay with an A. Factor assays. Okay.
A pen in there, boy.
Give me a NANDA diagnosis for can't cough. Give me a nursing. What would be the most appropriate nursing diagnosis for can't cough?
Can't
cough. When you can't cough, you got a patient that can't cough. Give me a appropriate nursing diagnosis.
I want to say
you can have like ineffective airway.
Ineffective airway clearance. Exactly. That's exactly what it is. Ineffective air. So just think about it. You're coughing to clear the airway. That's what the cough reflex is for. It's to clear the airway. So ineffective airway clearance. Absolutely. How do we consider medication dosing with children? What do we use?
Their weight.
Their weight.
Weight.
Yes. What color does amniotic fluid turn nitrazine paper?
Blue.
Blue. Why does it turn it blue?
That tests positive for
we know that it's testing for amniotic fluid, but why does it turn it blue? Why? What's the reason behind it?
I don't know why it turns blue.
Because it's alkaline, right? Yep.
Okay.
Amniotic fluid is alkaline. So urine is what?
Acidic.
Normal vaginal discharge is what?
Oh, normal. Alkaline.
Say it again. Come again.
Well, What was the question?
Normal vaginal discharge is what?
It's
acidic. It's acidic.
Acidic.
Yes.
Okay.
It's acidic.
Why is normal vaginal discharge acidic?
Because the pH in that area is acidic.
Okay.
Mm-hmm. So if that is acidic, then what is sperm?
Too acidic.
We would like to think so. It is actually alkaline.
Oh my God.
Yes, it is actually alkaline. Yes.
That's confusion because how is sperm alkaline when it can make a baby?
The reasoning why you're at risk for more UTIs when you become pregnant, right?
Mm-hmm.
Okay, so alcohol withdrawal. What is the drug of choice for alcohol withdrawal?
Is it
generic names?
Narcan?
No.
Was it the dish or something you said?
It's not a dish or anything.
I know it.
It starts with a C.
Mm-hmm.
Guys, got to study that. Put that down. That's homework. I want to know the alcohol withdrawal drug of choice. Generic names only. Remember, Nclex only tests you on generics, not trade names.
Did you already say it before?
Yes, I did. It was actually one of our practice test questions as well. And I actually accidentally gave you guys the answer. So you got that one right. Freebie. What is the drug of choice for supraventricular tachycardia?
SVT, I believe, is oh my gosh.
It wasn't the Elavil, was it?
Nope. Elavil is a tricyclic antidepressant.
All right.
Gosh, it's on the tip of my tongue.
Adenosine.
Yes, I was going to say stuff with an A, but I couldn't get it out.
Adenosine. I mentioned about Hirschsprungs. I know you guys know about the ribbon-like stools. We know that that's one of that's a classification of Hirschsprungs. We know that part. But we also talked about how it's diagnosed and what are we looking for. I mentioned that, and that was actually one of your test questions as well. So what are we looking for when we're diagnosing Hirschsprung's disease? What are we searching for? The absence of what?
I think I wrote that down.
We're searching for the absence of ganglionic cells.
No, I didn't write that down.
Write it down. Searching for those absence of those specialized cells.
And you said this is Hirschsprung?
Yep, Hirschsprung's.
Absence of
ganglionic cells.
Okay.
Who did we say was the universal donor? What blood type?
Oh.
Universal recipient?
Was it A?
AB. AB. AB can get anything. O can donate whatever.
Okay, I need to write that down. I think I messed up that AB can get any.
AB is the universal recipient. Yes, they can receive from anybody.
But
O is the universal donor. It can donate to anybody.
But it can't take.
But it can only take O. Right.
Got you. Yep. Okay.
What was the test to see if you have the RH factor? What is the RH factor test? Mm-hmm. What you guys been doing, huh?
You said, what was the question? I'm sorry, I was writing. What's the RH?
The RH factor. What's the test for the RH factor?
What's that test they get to the mothers?
It's Rogaine, right?
Nope, Rogam is the medication that they give you. Mm-hmm. It's the Coombs test. Coombs test.
Is that a blood test?
Yes, it is.
And what's it? I'm asking because I think when you go get your blood drawn.